be a training hospital, because I showed you the remnants of the National Teaching Hospital in Port-au-Prince, the general hospital where I spent like 9 months or so. So this project is going. It was designed by a Chicago architect. It was funded in pretty large part by local philanthropy and people who have invested in this. And it will become the new National Teaching Hospital. Built by money that was donated through Partners in Health. That's all paid for. The operational costs are difficult, and money's in place for a few years, and we're sure we'll get more. But it's being built on the mandate of the public health system at the to the specifications, to the need of the public health system. And there's a plan in place for over a 10-year process to completely get our nonprofit group out of administration of the hospital. So assuming the World Bank and the IMF and other big donors will contribute to this, we will be out of the business of running the hospital. It is a public facility and can potentially turn into a point of reorganization for the Haitian medical education system. A lot about it is very novel, which is exciting. Still needs to be met with training and personnel and the means to work through it. But the fact that we'll have a working ICU, the fact that we'll have an emergency room, there's a cancer center, the surgical specialties. There are things we'll be able to do in the surgical center that are completely novel, especially in the public sector. There's a CAT scanner. Where I work at the University of Chicago, we probably have 10 or 12 CAT scanners in the building. And Haiti has a few on the island. They're all in private hands. You can pay some money to get a CAT scan of mediocre quality. But we'll have a scanner, which is crucial for a lot of diagnostic work and for a lot of planning. So this is exciting. These are photos from just a couple weeks ago at the launch with the mayor of Murbalé, and that's Dr. Paul, and still some construction right there in the middle. So the hospital's been built as a big kind of letter C. The operating suite in the middle is still under construction, but after that's up, it's our job to staff it. One of the ways we'll do that is through increasing and advancing medical education. This is the first day of our new residency program. This woman is the dean of the Haitian State Medical School, and came to wish these students well. Four of whom had studied at the Haitian National Medical School. One at Notre Dame, the Catholic medical school, and one who trained in Cuba and had come back. So this kind of momentum to provide 6 new doctors in the public sector, no small feat, to hire in some faculty to support them, to give me something very focused to do. I'm going actually tomorrow, if the weather doesn't hold things up, I'm going tomorrow to do some cardiac work, and we'll be teaching these residents if I can get there. And so this kind of momentum is really exciting, and I think, at least for us, it's where we're putting our dime for the next bunch of years around training, capacity building, education, and of course the infrastructure that goes with that necessarily. One picture doesn't show very well, but this is a artist's rendering. This is Butaro Hospital in northwestern Rwanda that was opened about 3 years ago now. The largest hospital in the public sector, again, a public-private partnership on land that was given by the Rwandan state for the hospital to be built. In a really kind of wonderful turn, the site was a former military base that was fairly important, as the whole country, as many places were, but this was a former military base that was part of the genocide 16 years ago. Now it's a nice hospital. And hopefully not the last that will build of this kind of size and potential to create education and to hopefully help stabilize these places. I'm not going to, this is sort of doctory stuff, and I'm not going to talk about it unless it comes up, but next big wave, like I was joking, not joking about, we say we can handle infectious disease. Then the other thing that poor people have is other illnesses, other chronic fixable problems like congenital heart disease, depression, asthma, diabetes, these kind of things. And so much of the work that we're doing now is around that epidemic of neglected problems. There's certainly not enough work done in the world to identify and treat depression, which has incredible consequences to people's lives and livelihoods. And so this, what we call the long tail of global health equality, is kind of the next phase. And I'm happy, of course, to talk about that as a medical kind of person. I think that's all I wanted to say. It's certainly plenty. I'd love to talk, and then I know we have a chance to hang out too afterwards.
Yeah. Questions here regarding who was actually contracted to do the construction of new buildings, and did they have good planning for sustainability? I know it's a bit like the solar panels there.
Yeah.
I mean, is it the kind of technology where you walk in a room and the lights come on, or when no one is there, they're off?
Yeah, great
Are
question.
those types of sustainability processes
integrated? The project has been hard to build because so much needs to be built in Haiti, so it was quite a trip to get contractors. But the biggest firm is from the Dominican Republic, so a lot of the heavy machinery is from the DR, but 80% or so of the employees are local. The building itself is quite simple and almost entirely one floor. And so with that, passively ventilated, so there's no money spent on that. The lighting is often passive. There are some infection control measures that go in with that. The solar capacity will actually feed back to the grid. We'll have backup generators for emergency, but it's enough power to actually partially feed the town. And the other most exciting thing about it is it's built to the Dominican earthquake standard, which is more stringent than California earthquake code, so it will hopefully survive.
That's the next question.
Yeah, the next thing should happen. Most of the roof is made of these very low tech, but basically styrofoam blocks underneath the plastering. It's pretty amazing place.
Another question for you too. Is there a women's center?
What's that?
Is there a women's center?
Yeah, the first thing to open will be the labor and delivery and pediatrics. So yeah, women's health is certainly the right thing to do. It's also unavoidable. If you want to build a decent center, there needs to be a focus on women's health. The most, beyond providing basic safe delivery and prenatal care and these kind of things, we're also, with this new physical capacity, going to be able to finally create a good cervical cancer screening system. We've never had a good one. We've had programs for years. We've been doing vaccination for a number of years, but we're really hopeful that with a center of this size, we'll be able to kind of get ahead of that at least a little bit. Yeah. What was the question here?
Well, I guess my big question is, when you're talking about social medicine, I almost choked really, because I wonder if there's anything that your work has to offer the conversation here. We don't talk about social medicine anymore for 20 years. We talk about socialized medicine.
Right.
I mean, the conversation just seems to not be able to.
Yeah. So yeah. No. Thanks. I'd love to hear. Socialized medicine is just a way of delivering medicine. Yeah, it's a different problem, and it actually works. I don't know how you students are looking at health things, but we're spending about 18% of our